Welcome back to Mountain Health Today. I'm your host, Ted Owens, and our guest today is Chief Executive Officer of the Tahoe Forest Health System, Harry Weiss. Harry, how you doing?
Doing great. Glad to be here with you today.
Glad to have you back. It's been, what, 3.5 years or so now up in the Lake Tahoe area with Tahoe Forest?
Yeah, hard to believe already, 3.5 years.
And a lot of things have changed, and we're going to talk about some of that today. One of the things I think I'd like to begin with has to do with primary care. And primary care is really the first touch point of care in most communities. But that wasn't the case when you arrived in ours. Why don't you share a little bit about your observations?
We saw that there was a huge unmet healthcare need when I got there of a primary care presence, and we really didn't have a tightly connected large primary care footprint at all in our health system, and there appeared to be a pretty significant demand for that, and so we started on a journey 3.5 years ago of recruiting family practice physicians and nurse practitioners and physician assistants as well, so that that we could really respond to that need, so that we could really answer the question, can we see you today or tomorrow or this week, and really provide that care that they really need.
One of the problems I think that's existed, out in rural communities is void of primary care opportunities, such as you've described. Folks very often would end up in the emergency department. And what kind of an impact does that have, say, on a health system like Tahoe Forest?
The emergency department is the most expensive door to walk through to access health care, and our core goal to be good stewards with our residents in our community is how can we keep them well, how can we keep them out of the ER, how can we keep them out of inpatient units for illness reasons, and we knew that we really needed to establish a primary care footprint.
And so, but it's also to the patient, it's their benefit because they establish a relationship with a primary care clinic or physician.
Absolutely, and we really want to establish that because the best healthcare today is proactive, it's relationship-based, it's holistic, and so it's not just episodic, and we really want to be proactive and deal with all of those issues that a patient might have. Just 2 days in a hospital, for example, is equal to about 80 physician office visits. So we'd much prefer our patients be seen regularly in a physician office setting.
So when I was younger and I lived up here and the entire Lake Tahoe area, Truckee area hadn't grown as much as it has today, when I didn't have that opportunity, I would just suffer through what it was that I had, right, wrong, or indifferent. And that's a problem for a community too, particularly with the Affordable Care Act.
Sure, and what we're able to do now with having a strong team of primary care physicians, we can deal with illnesses, we can deal with injuries, viruses, any type of ailment that a patient might need care for, and a little teaser is now 7 days a week.
So you actually, your journey was to establish a 7-day-a-week storefront clinic.
Absolutely. Our community deserves that. Illnesses don't just arrive Monday through Friday. And so we said we got to do something about Saturday and Sunday as well.
So, but not to belittle it, excuse me, it's more than just flipping a switch. It took a lot of planning.
It did.
So you described the recruitment part. How'd you design its location? You had to construct it.
We were fortunate to have in a building that many in our Truckee area know. It's entitled the Old Gateway Center at 10978 Donner Pass Road, and it's a large set of offices and so forth there, and we did expend some significant dollars to remodel it, create additional exam rooms, and we have more than a half a dozen providers that regularly work there today. day and now 7 days a week.
And that was launched in October of 18, I believe. So it's open daily?
Yes, we started that special 7-day week program back in October. It's open probably 8 to 5:30 approximately, 7 days a week today. You can walk in or you can have an appointment, either one, and we can see you 7 days a week.
Walk-in or appointments, and I have here, and I'll read it off, 530-582-1212 if you would like to call in. So people can walk, set an appointment. It's all designed around their convenience.
Absolutely. Great service, and we've had many positive comments about the fact that Truckee now has 7-day-a-week provider care.
Well, and it serves the North Shore as well, so folks can drive on over. They know there's a place to go. They can walk in, they can call, and it'll take a little while for locals to adapt to its availability, I'm sure, but you're satisfied with it and it's doing its job?
Yeah, it's we've only had positive feedback, and our providers love making the new friendships with patients, and again, we are seeing patients from all around the lake that are coming over, especially on weekends, etc., when they're looking for care.
Well, for those folks at home just tuning in, we're talking with Harry Weiss, CEO of the Tahoe Forest Health System, a success story for the first time in its history, a 7-day-a-week primary care clinic, and we're going to talk about a few other things in just a moment. We'll be right back. Welcome back to Mountain Health Today. We're having a conversation with Chief Executive Officer Harry Weiss. Harry, we're back, and I enjoyed the first segment. Primary care clinics doing very well. First time in Tahoe Forest Health System's history. So let's talk about something that not too long ago was another first, and that's the Gene Upshaw Memorial Tahoe Forest Cancer Center. The cancer program was established, 10, 12 years ago, but the Cancer Center building is up and operational. Tell us a little about how it's functioning today.
It's an amazing full-service cancer center program, and I have never forgotten my first week there when I did a walk through. I said, man, this is one of the rarest fully comprehensive cancer centers I've seen, even in urban areas, that covers all of the medical oncology, all of the radiation therapy, and such a nice setting that really lifts your spirit, and also to see the quality that it provides is amazing, and I think we should really talk for our audience about that quality, and we have significant in-migration of individuals who choose to come see us from many miles away.
So I was going to go there. First off, Tahoe Forest is a critical access hospital.
Absolutely.
But very unusual one with its array of services. And in a rural environment. The Cancer Center is really an unusual gem for a community the size of the North Lake Tahoe area to have.
Absolutely. It would be very rare for a critical access hospital to have a full service cancer center anywhere in America, so that adds to the special nature here.
And while there may have been some critics that didn't think it was something that should be there, you mentioned in-migration. Its reputation has grown tremendously. Share with us a little bit about that. I know that there are a lot of folks that travel from afar to go to the cancer center.
Right. Our geography that our district serves is quite large, but even in spite of that very large geography, more than 50% of our patients come from outside of our area to seek cancer care, and we're very pleased ways to have a connection and affiliation with UC Davis, and we're a rural center of excellence with them as well. And it also provides day-by-day cancer tumor boards where you get these very specialized second, third, and fourth opinion of tough cases.
But just for the folks at home, that's the Hollywood Squares. That's all the
Right.
television screens, providers from other institutions, and every day at lunch they discuss cases. So you get multiple opinions on a case.
So any patient who does have cancer, you would absolutely want to have the wealth of knowledge that exists in a cancer tumor board where you can see the best specialists in premier locations around the region. They get to review the case and make their recommendation and create a focused treatment plan for the best possible outcome.
So it's one thing to have a cancer center in a rural environment. That's very unique, and that's, I think, certainly to be commended and honored. But beyond that, it's the quality. You mentioned the quality a little earlier, and I understand the Cancer Center, the Gene Upshaw Memorial Tahoe Forest Cancer Center, has earned its 3-year accreditation. And I'll let you explain the organization, but I understand it was with commendation.
That is correct, and it's rare to get this type of accreditation with commendation from the American College of Surgeons, and it's pretty rare that a facility receives that, and that means that it really met or exceeded all of the Commission on Cancer Care criteria that they have. And the American College of Surgeons is probably the most respected accrediting body across the country. It's famous for accrediting trauma centers and all sorts of programs in the healthcare setting.
So to achieve an accreditation such as this, that's not an accreditation that is very common, even in your more urban, metropolitan areas. That would be prestigious there.
Yeah, it would be rare in a urban metropolitan area, and especially very rare in a rural area.
Well, I know that being in a small community, the Cancer Center has touched many people. Cancer touches all of us at one time or another, family, friend, and I think that it's extremely well valued, to the surprise of many. So I think that's to be honored. And tell me a little bit about the patient-centered care. It has some philosophy in the manner in which patients are treated.
From day one, we're really looking at putting the patients at the center of all we do in a very holistic way and trying to be their advocate in every way, looking holistically at all of their needs, to make sure that they have the very best experience and have the best probability of a positive outcome as well. And
strong foundational support, I know as well, for things that aren't covered by insurance.
Absolutely, and that also adds to the very rare special programs that we have, that we do have strong philanthropy that does provide for a whole variety of services, whether it's psychological counseling, whether it's acupuncture, wigs, and just a variety of other critical issues that may not be covered, that we have resources for those as well.
Well, before we take a break, I did want to point out also that in my notes, Tahoe Forest has a 5-star HCAHPS rating for the quarter, but that you change a little bit here and there, right? Bounce around 4 or 5?
Yeah, we've
Mostly
typically been in 5 and maybe 4. Both of those are in kind of the very good to excellent range.
Well, I just wanted to get that in there and say congratulations.
Thank you.
We're talking with CEO Harry Weiss of the Tahoe Forest Health System. This is Mountain Health Today. We'll be right back. Welcome back to Mountain Health Today. I'm your host, Ted Owens, with CEO Harry Weiss of the Tahoe Forest Health System. Harry, before I cut you off, we went to a segment. You have achieved a 5-star HCAP rating, 4 or 5, usually 5. It's a quarterly rating. But off air, you shared with me that's tied for #1 in towns like us.
Right. As we look at hospitals in America, there's a U.S. national average performance. Then there's Baldrige performance that's way above that. And then you have roughly a dozen ski towns in America that have even a higher level of performance on patient satisfaction and quality. And we've been tied for #1 in that level. And that's just our thank you back to our community from a very dedicated team who loves their community.
We're competitive.
You bet.
Very good. Okay, we're going to talk about Women's Choice Award that you recently obtained for the Joseph Family Center for Women and Newborn Care. And this is the 4th year with that designation as one of America's best hospitals for obstetrics. That's also unusual in the mountain community, is it not?
Absolutely. The Women's Choice Award is an amazing special award that really recognizes high quality and safe obstetrical newborn care in any setting. And this award means that Tahoe Forest Health System was in the top 17% of almost 2,800 hospitals in America that offer OB services. So a tremendous accolade, and it should hopefully provide great assurance to young families as they're looking for where's the best place to go for high quality, safe OB
well,
care.
I was going to say, it's a legacy service, certainly, if folks know the history of Tahoe Forest. But to be that well regarded on a national basis really says a lot. My observation is we seem to have more and more young families moving into the region.
Right, and a lot of great feedback, positive feedback on their experience. And not only do we have the Women's Choice Award, but we're also recognized as a baby-friendly obstetrical service as well. And there's only a few hundred of those type of accredited facilities in all of America as well, too. So that's an additional angle of really respecting newborns and how to give that newborn the very best chance for great health as they grow up.
Well, I'm going to change gears a little bit on you to something that's not so pleasant.
Sure.
This is a national problem. It has to do with behavioral health. Certainly, we're no different than the stories that we're hearing across the country with substance abuse and behavioral health combined. You've taken some action on this. Sure.
We have, Tahoe Forest really didn't have any mental health services, behavioral health services prior to my coming, and we have built a whole team. We have psychiatry. We have a very experienced physician assistant who has psychiatric experience as well. We've also added a couple of our family practice physicians who have a special credential that can treat and provide alternatives to opioid addiction. And when we look, the reason this is so important is that there's varying estimates, but at a minimum, 1 in 5 Americans have some type of notable mental health illness, during their lifetime. That's at least 58 million people in America, and it's a need in our community, our region, just as it is nationally. And the other thing that really concerns us as well is that there's more than 2 million people in America that have an opioid addiction, and 72,000 deaths a year from that as well. So these are just a few of the reasons why we've built the first stages of a strong mental health and behavioral health program here at Tahoe Forest.
And it's a bold step because I know that, the federal government, with most of their programming dollars and what have you, filters through the states and then down through the counties.
Right.
And we're a little challenged being a rural county geographically, so a lot of the services that exist maybe down in the foothills of California haven't existed.
We do really have to work closely with our counties. Placer and Nevada County, they're a critical partner for many aspects of a successful program.
But you haven't stopped there.
We have not.
So I don't know how everyone keeps up with you actually with this, but you have some new services coming soon, ENT and plastics and endocrinology. So why those? I can understand ENT, but
yeah, ENT, and we also were blessed to have an individual who has a fellowship in facial plastic, Dr. Jeff Watson, as well, and really happy to have him in our region. But a lifetime, we've had ENT in the past, really happy to have
just for everybody, that ear, nose, throat. Okay.
Yes, ear, nose, and throat. But really happy to have, for a first time in our 70-year history of our health system, endocrinology services, and a huge unmet medical need relative to thyroid, diabetes, and other related conditions. And so we'll have a new practitioner hopefully in May or June.
And all of this is driving towards the increasing demand for services in our region. We face it, Barton faces it at South Lake as well. We're growing.
Yeah, these are just critical day-by-day quality of life needs that have gone unmet in our community that we do need to solve. And we're also adding another general surgeon with a colorectal specialty too, to be able to care for just another critical unmet need in our community. We're really trying to respect and honor those year-round residents in our community.
Well, Harry, thank you very much for being with us. You've been watching Mountain Health Today from the Tahoe Forest Health System. I've been your host, Ted Owens. Harry Weiss, CEO, thanks so much for spending time with us.
Thank you very much.
You'll come back.
Thanks.
Good. Thank you. Welcome to Mountain Health Today. I'm Ted Owens, your host, a program supported and produced by the Tahoe Forest Health System about all things healthcare. Our guest today is Chief Executive Officer Harry Weiss. We'll be back in just a moment.